Ever wondered how mothers in the ancient world, before modern medicine, sterile tools, or even trained midwives, managed to survive childbirth? They didn't always. In fact, many didn't. But the ones who did, they were part of an unspoken, brutal, and deeply practical system, built for survival. Not comfort, not care, survival. Let's start with the basics. Pain relief, or rather the lack of it. In ancient Egypt, women gave birth squatting on specially carved birth bricks, two flat slabs about 1 foot off the ground. There was no cushioning, no privacy, and no anesthesia. These bricks weren't symbolic, they were functional. By forcing the woman into a vertical position, gravity helped speed up labor. Archaeologists have found worn impressions on surviving bricks, evidence that women clutched them so tightly their fingers wore grooves into the clay. In ancient Rome, the process was similarly pragmatic. Wealthy women sometimes had access to wet nurses, midwives, or herbal treatments. Poor women? They had the floor, the wall, or the dirt beneath them. Pliny the Elder, writing in the 1st century CE, casually notes that many Roman women gave birth alone, especially in the countryside, without trained help. And if you were enslaved, your master might not even know you were in labor, until you were back at work a day later. Ancient Greece? They had mythology. Stories of Leto, writhing in pain on the island of Delos while giving birth to Apollo and Artemis. But myth offered no pain relief. Real Greek women were expected to stay silent during labor. Philosophers like Aristotle even argued that excessive screaming was unnatural. The expectation was control, quiet, endurance. What passed for medical help was sometimes worse than nothing. Roman gynecological treatises, like those of Cyrannus of Ephesus, include terrifying remedies: crushed beetles, goose fat, wine boiled with myrrh, applied directly to the vulva. There's even a recorded method that involved placing the severed foot of a hyena near the mother's head to ease the pains. It's not just that ancient mothers lacked help, it's that their cultures often saw their pain as irrelevant, a normal part of womanhood, unremarkable, even expected. And yet, women survived. Somehow. The key? Ingenious, communal, and sometimes shockingly brutal strategies, honed over generations. Let's talk architecture. In many parts of Egypt and Mesopotamia, domestic spaces were designed with childbirth in mind, but not in the way you'd expect. The delivery space was often the hottest, most cramped corner of the house, warm, dark, and out of the way. Not for comfort, because heat relaxed the muscles, and darkness was believed to keep away evil spirits. Studies of surviving homes from Deir el-Medina show that birthing corners were insulated with layers of cloth and lined with reed mats, probably reused dozens of times. In the Roman world, the childbirth space was often just a sleeping room, sometimes even shared with livestock if you were poor. But the setup wasn't random. Women laid thick wool blankets along the walls to muffle sound. Jars of water were placed nearby, not for hydration, but to be heated for washing the baby or cleaning blood off the floor. And then there's the silence. Ancient childbirth was intensely physical, but also culturally restrained. In Greece and Rome, women were often expected to give birth without screaming, especially if male family members were nearby. Aulus Gellius reports with admiration that one noblewoman gave birth as quietly as if she were in sleep. That wasn't bragging, that was social pressure. But perhaps the most ingenious survival strategy was what we might call biological improvisation. Take the practice of second births. Across multiple ancient cultures, women who had previously given birth were expected to coach younger women, not during labor, but years before. It was a kind of informal education. In rural Greece, inscriptions show that elder women were honored as maiai, not quite midwives, but birth veterans. They knew what positions worked, what herbs might help, and what signs meant the baby or the mother was in danger. No certification, no formal apprenticeship, just knowledge passed mouth to mouth, womb to womb. In Egypt, Temple records show that women frequently offered small votive figurines of Hathor, the goddess of fertility, with inscriptions like, "Hathor, grant me an easy birth." These weren't decorative, they were psychological armor, amulets, charms, chants, all meant to help the woman stay calm. And calm mattered, because if something went wrong, you were on your own. We know this because of the anatomical realism in surviving medical papyri. The Kahun Gynecological Papyrus, dated to around 1800 BCE, describes what to do when the child does not come. The instructions? Massage the abdomen. Lay hot bread soaked in beer across the belly. Pray. And if that fails, nothing. The text ends. No cesarean, no further instructions, just silence. Even in Rome, where medicine was more advanced, cesareans were only performed on dead women. The Lex Caesarea made post-mortem cesareans a legal requirement, to save the child if the mother had died late in pregnancy. In other words, the mother was already considered lost. That's how dangerous childbirth was. Help came too late, or not at all. So what did survival look like? It looked like choosing the right season. Roman writers mention that births were less dangerous in spring, not because of astrology, but because the air was milder, the risk of infection lower, and clean water more available. It looked like spacing children. Greek vase paintings and Egyptian tomb art show women with 2 or 3 children at most, not because they didn't want more, but because the risk multiplied with every birth. It looked like storing herbs, boiling cloth, knowing which local tree produced bark that could slow bleeding. It looked like your sister pressing her forehead to yours, whispering instructions she remembered from her own labor. It looked like blood, and grit, and silence. But let's talk about what happened after the baby was born, because surviving the birth was only step 1. First, the cutting of the cord. In modern hospitals, it's sanitized scissors. In ancient Egypt, flint. Actual sharpened stone. Microscopic analysis of flint blades found in Theban burials shows wear consistent with cutting soft tissue, like umbilical cords. Some blades even contained trace amounts of human blood and amniotic residue. There were no clamps. Instead, a wad of linen or a knot of reed fiber was tied tightly around the base of the cord. Then the stone did the rest. Infection was common, survival was not. And then came the bleeding. Modern postpartum hemorrhage is treated with IV fluids and oxytocin. In ancient Rome, it was treated with wool. Records from Roman midwifery texts describe inserting rolled wool soaked in wine and vinegar into the birth canal to absorb and purify. Whether it helped is unclear. But the intention was precise: stop the blood, seal the wound, and pray. Because if you kept bleeding, there was no second chance. And yet, some mothers survived. Again. How? By hacking together survival protocols from whatever they had. In ancient Greece, new mothers were rarely left alone in the days after birth. Archaeological findings from Olympos show that certain sleeping areas were converted into semi-isolated rooms, separated with cloth dividers, sometimes near the kitchen fire, often stocked with storage jars for hot water and small bowls for mash or soup. The postpartum recovery zone was private, not sacred, practical. In Egypt, tomb scenes show women lying on mats while attendants prepare food, grind herbs, or fetch water. These aren't abstract images. They're instructions. Warm broth, massage oil, clean linen, the basics of recovery. One papyrus even describes placing honey and ground date in a linen cloth and applying it to the lower abdomen to draw down the womb. No one knew what prolapse meant, but they saw it happen, and they tried to fix it. The postpartum period was also a ritual vulnerability. In Rome, mothers who had recently given birth were considered impura, ritually unclean, for at least 8 days. This wasn't just spiritual, it was a form of forced isolation. The woman was kept separate to rest, avoid infection, and, crucially, not die. But rest was a luxury. Most ancient mothers were expected to resume daily tasks within days. In Greece, inscriptions from rural sanctuaries record offerings from women just 3 days postpartum, proof they were already moving, already back among others. In the Egyptian village of Deir el-Medina, Ostraka, scrap writings show that enslaved mothers were returned to work in as little as 48 hours. Laundry, water hauling, grain grinding, with torn muscles, with fevers, with newborns. Childbirth wasn't a protected time, it was an interruption, one that had to end quickly. As for the baby, immediate survival was just as uncertain. Without sterile environments, umbilical infections and neonatal fevers were common. Newborns were often swaddled in multiple layers of linen or wool, tight enough to restrict movement, which ancient writers claimed trained the limbs to grow straight. But modern researchers suggest this may also have been a desperate attempt to keep fragile bodies warm. In Rome, new infants were rubbed with salt and olive oil, part ritual, part disinfection, part superstition. In Egypt, newborns were sometimes anointed with a mix of natron, a natural salt, honey, and powdered frankincense. Antibacterial? Yes, but often applied by unwashed hands. We have the infant mortality numbers, and they're devastating. In ancient Greece, some burial grounds show that nearly 30% of all grave goods belong to children under 1 year old. In Roman Egypt, demographic reconstructions estimate that up to 40% of children died before their 5th birthday, with the highest concentration of deaths in the first week of life. But still, some survived. Enough to build empires. And for those who did survive, their mothers had to nurse them. With no formula, no bottles, no backups. Breastfeeding wasn't just encouraged, it was expected, and not just for nourishment. It was the only form of immunity a baby had. Ancient texts often described colostrum, the thick yellowish milk produced right after birth, as divine, or the first medicine. They didn't know the biochemistry, but they saw the outcomes. Babies who received it lived more often than those who didn't. Mothers who couldn't nurse, due to illness, malnutrition, or injury, had two options: a wet nurse or death. In wealthy Roman households, wet nurses were hired, sometimes even enslaved specifically for the purpose. But outside the elite, there were no backups. A mother with damaged nipples, infected breasts, or postpartum fever couldn't simply opt out. Some tried feeding infants goat's milk from soaked sponges, or letting them suckle from animal teats directly. The success rate? Unclear. The desperation? Obvious. And yet, the maternal system evolved, not through science, through trial, error, and oral tradition. We've found amulets and spells across the ancient world meant to calm the womb or charm the milk. In Greco-Egyptian magic papyri, one charm instructs the mother to draw 3 circles on her breast, recite a prayer to Isis, then burn the drawing in oil. Nonsense to us? Maybe. But for a woman bleeding, feverish, and half-starved, it was something. A ritual, a routine, a reminder that others had done this before.